I'm Dr. Sagar Lonial from Emory University in Atlanta, Georgia, and I'm here at the ASCO 2013 meeting in Chicago, Illinois. And what I want to spend the next few minutes doing is really talk about the plethora of new drugs that we have and break them down into how I as a clinician think about those new drugs, which is really basically classes of agents or ways to deliver therapy. And we'll start with the two most common and most effective classes of drugs, and those are the proteasome inhibitors and the immunomodulatory agents. So in the proteasome inhibitor category, we have bortezomib, we now have carfilzomib, and there are now oral versions of both those drugs that are in clinical trials. One is called MLN9708, and the other is called aprozomib. And these are all similar in that they block the proteasome, but they're different in that they have very different toxicity profiles and may have different potencies. And so that's a really important backbone class of drugs we use in myeloma. The next really important class is the IMiD class, and that started with thalidomide many years ago, was then supplanted with lenalidomide, and most recently we have the approval of the third drug in this family, pomalidomide. And pomalidomide, all of these drugs again work through a somewhat similar mechanism, but there are differences in potency and efficacy such that pomalidomide appears to be probably the most potent of the IMiD agents we have, and this forms the other major backbone of therapy for patients with myeloma. The other categories that I think are really exciting and are up and coming now, the first is monoclonal antibodies. Elotuzumab is one that I think we're very interested and excited about, combined with IMiDs like lenalidomide and hopefully soon pomalidomide. There's also daratumumab, which is an anti-CD38 antibody, has very exciting activity in preliminary phase 1 and phase 2 studies. And there's also the CD138 antibody from Biotest, the Biotest antibody, which again also looks very exciting as new mechanisms and targets of therapy. There's a class called HDAC inhibitors or histone deacetylase inhibitors, and varinostat is probably the one that didn't have the positive data that we were looking forward to, but there's a second generation agent called panabinostat that we hope will have significant activity, and even newer versions called ACY1215 or rosalinostat, which are also very active and exciting as well. Finally, there are other categories of drugs that are in very early phase 1 and early development. The kinesin spindle protein inhibitor, Array 520, is one that we're very excited about. There are other classes of drugs like the Karyopharm agent, which is a nuclear transport inhibitor, the KPT drug, which also looks very exciting, and many, many other new drugs and new targets that you'll hear about at this meeting or at future meetings in the next 12 months. Thank you.